All right, hey guys, today we have a special treat for carpal plastic surgery because I'm picking up one of my patients, Chelsey, and she's had a breast augmentation previously, and she's gonna talk to us a little bit about her experience with that, and hopefully it will be very informative. So there she is, and we'll have her come right in. How's it going?
Good.
Welcome, welcome.
Hello.
Your first official patient on Plastic Surgery Carpool, so it's very exciting. Thanks for joining us. All right, so this is Chelsey, and you had breast augmentation, and I was just basically going to ask you some questions about that experience while we cruise around, just because I think it'll help people out in making their decisions. So I guess we could talk about, like, had you been thinking about breast augmentation for a long time? Was that something you'd kind of considered for a while and then finally decided you wanted to do it?
I was thinking about getting my breast augmentation done for probably 4 years.
Okay.
Something I was very back and forth on with my training, and just the recovery time was that I had heard about was going to be an issue.
Because you work out a lot,
yes.
for people who don't know. Yeah.
Yes.
And so, yeah. So that was kind of holding you back as far as, like, when can you find time to do it, and how long is it going to take you to recover and get back to the gym?
Yes.
Yeah. All right, cool. And then what did you think about, like, the whole sizing process and going through that? I mean, a lot of girls say, well, I don't know what size to get, and I find it very confusing. I mean, we use the sizers in clinic for you to try on. Did you find that that's accurate?
That was helpful with me. I looked through pictures of different girls with the breast augmentation, and I kind of figured out what I did want to look like or what I didn't want, and I explained that to Dr. Blagg.
Right. And I can't remember if you showed us pictures, but sometimes people will do that, of breasts that they like. So if you go online and find those or before and after pictures, that's actually really helpful for Janice and me whenever we're sizing with you. Because sometimes people will come in and they'll say, oh, I want very natural appearing breasts. And I'll say, okay, I think I'm on the same page. And I'll say, show me a picture of what you like. And it's like Pam Anderson, basically, like super round and big. And like, well, wouldn't call that natural. I mean, they look great, but I wouldn't call it natural. So yeah, the pictures can be a good thing. You know, for us, I think the sizers have been kind of the best way that we've come about trying to get people to understand what it's going to look like. We had this like 3D technology for a little while, our virtual reality, where you could look down with this goggles on and see what it was going to look like, but the software kept malfunctioning. So that's a cool idea, but I think that those sizers are a pretty good way to get a ballpark of how it's going to look, seems like. What do you think, how was the recovery for you? What would you describe, like, day one, you get home from surgery, is there a way you would describe the pain? Was it easy for you? Was it the worst pain you've ever felt in your life?
Worst pain I felt, yes.
In your life?
Yes.
Yeah. So, was similar to a hard workout for you? Do you feel like?
My description would be zingers, where the incision was made.
Oh, okay.
I guess just when I would lay down flat trying to get back up, I couldn't do it on my own.
Yeah.
But I don't really remember much of the first couple days from
That's good.
On this.
Forget the bad. It's like having a baby. Like, people forget. So that's good. Yeah, it's hard for me to explain sometimes for patients how their pain's going to be. What a lot of patients have told me is, one, for women who have had children, they say, well, it's like when my milk came in. And then for those who do work out a lot, sometimes they'll say it feels like I did like more push-ups than I've ever done in my life.
Yes.
Like that kind of pain.
Very tight. Yeah, it was very tight.
And then do you remember how long for you that took before it kind of broke to where you felt like, oh, okay, now I've like can tolerate it a little bit better without pain medications?
A week.
A week.
Yeah.
Okay. And then as far as getting back into working out, how did you manage that? Like, I guess physically and mentally, right? Because I hear from a lot of people, and I can understand. I mean, it's not like I don't work out like you do, but I mean, I need physical activity, like, for my mind to feel good.
Yes.
How'd you handle that? Because I restricted you.
I did try to go on walks.
Yeah. Which is fine right after. I always say you can go on walks and just don't run.
Yes.
And you don't want to bump your heart rate in those first 2 weeks really too much. So you go on walks. What about diet-wise? Do you do anything different diet-wise?
So I normally meal prep during the weekdays, and I just kept up with my meal prep. So that, because I was nervous about gaining weight within the 8 weeks that I was restricted to working out fully.
And so pretty much did that. And then what about when you did get back to the gym, did you find that it was hard?
It wasn't hard. I just felt weird lifting up weights, even just doing legs and holding them down by lifting up the weights and holding them down by my legs. My chest felt tight.
Even that felt weird?
Yes.
Yeah. And what about now? Does it still feel weird to you sometimes? Do you think about it, or do you think, oh, that's my new normal? Or
I have no limitations now in the gym.
That's good.
And I'm almost a year post-op.
Cool. What other advice? Any other advice you give for somebody like just starting the kind of process of breast augmentation? Is super common, obviously. I mean, it's like the most popular thing that we do. So I feel like a lot of women, when they come in, they say, oh, I've been thinking about this for so long. And I always ask, well, do you have any friends who have gone through the process before? Because honestly, I feel like those are the ones who have friends are the ones who are most informed and have kind of the easiest go of it all because someone's told them all this advice. Is there anything else you think that people would need to know that if they're thinking about getting breast augmentation?
I think it's good to ask people what their recovery process was because everybody's body is different and the recovery is different for everybody. So it's good to ask different people and get different advice from them.
Yeah, that's a really good point because that's kind of like I always say it's all over the board. I do have some patients who come in the next day and they say, no, I feel fine, not a big deal. And then I have others who are like, this is the most pain I've ever felt in my entire life. And and I just always say I do the same thing every time, so I'm not sure why you are either suffering or not. But anyway.
And I don't know if it's just different from, I was almost like pretty much completely flat chested, so I don't know if the stretching of the skin is what makes the pain more or less.
Yeah, and I do think, and that's another good point too, is also when you're looking at before and after pictures, sometimes you need to look at, if you like the after picture, it's useful to look at that before and say, do I look like that person before? Because you mentioned if you have very little breast tissue, then you're going to look obviously very different with a certain size than if you started out with more breast tissue. And I think it is harder for you guys who haven't had a baby before and you don't have much breast tissue to begin with because you haven't had that skin stretch with babies and maybe weight gain and loss over time. So, all right, well, cool. Well, thanks for doing our carpool. That was fun. And I have a t-shirt for you. It's a Plastic Surgery Carpool t-shirt. And you're the first one to get it. Well, Janice has one, obviously, but you're the first patient to get it. So there you go. Thanks for joining us today.
Choose him. He's the best surgeon, clearly.
See, free endorsement right there. It was after I gave you a t-shirt, though. All right, thank you very much.